of the Granite List Live. We are thrilled to be coming to you live from SIIA's National Expo and Conference here in Phoenix, Arizona. I'm joined today by Rob Gelb, the CEO of Valenz, and he's going to talk a little bit about his company. I'm your host, Sally Pace. So Rob, thank you for joining us. Why don't you start by telling us a little bit about you and the company?
Well, first of all, thank you. This is an honor. I understand I might be the first one to go today, so hopefully this is a good baseline for everyone. But I'm Rob Gelb. I'm the CEO of Valenz Health. We are an organization that people may know from other brands over the years, but we rebranded in 2019 as Valenz, actually at SIIA in San Francisco, which is pretty cool. And then 22, here we are, and now we're the title sponsor for the show. Our business really is very, very simple. It is assisting employers in identifying and accessing high-quality care at a reasonable cost for their employee members and their dependents. That's really the simplest way to think about our business. We do that through a variety of different tools, I'm sure we'll get into. In 2019, we launched as what we called an ecosystem. We told the market that's what we were going to get to. Today, I'm proud to tell you we're an ecosystem, but more than that, we're actually yes and. We are a healthcare ecosystem optimization platform. And as we talk, I'm sure we'll get into what that means.
Well, I'd love to jump right into it. All right, so tell us, you talk about ecosystem. What does that mean to you guys?
So you have open and closed ecosystems. You have organizations that run their own ecosystem, and then they sit inside a larger ecosystem. That's really what we are. We've opened that and expanded that to treat our organization and our partnerships like a platform business. So the opportunity then exists for us to have a platform of technology, of processes, of networks, of all kinds of solutions that take the member from the earliest part of their journey, direction of care, and help me find a provider, and what does my plan allow me to do, straight through to I got this bill and I am not sure what I should or shouldn't pay for. And when we do that, while the majority of the solutions are really built and integrated and proprietary to Valenz, there's an opportunity for us to bring in from the outside partners that really have developed very highly specialized tools and resources that improve that experience for the member, get us to high quality care, and allow us to identify reasonable and equitable costs for those members and for the plans.
Awesome. And I know we from the Granite List have crossed paths a number of times at SIIA. You guys have been incredible supporters. I'm very fortunate to get to serve on one of the committees. Can you talk a little bit about what that, aside from the big reveal at the conference, what that relationship has looked like and what it has meant to you and your team?
Yes, so I would have to say that SIIA has been one of the staunchest supporters of Valenz. Mike Ferguson, I'll call him out specifically, has become a friend. Mike is an innovator, he is a listener, he's a creator, he's a collaborator, he's a person who brings people together. We saw that in 19, and so in 2020, we went all in and became a Diamond member. We've been a Diamond member since. We continue to invest heavily in SIIA and the opportunities and the partnerships and the collaborative approaches that exist from that. I sit on the Diamond member board, and that's truly exciting, dealing with like-minded professionals who are really trying to make good and do good in this self-insurance space. So they've been just a tremendous advocate and partner for us. They've allowed us to bring our brand to market and bring it to life and bring visibility to it. Along the way, we've made so many friendships and so many partnerships with them. It's really been exciting.
Well, on behalf of SIIA, thank you for your tremendous support as well. So I'd love to know, as you've gone through this journey, and we all are painfully aware of what it must have been like to have rebranded several years ago and then go through all the excitement that we've seen. What are some successes? What are some things that the audience needs to know about Valenz and the ways that you've helped people?
Yeah, I would say that categorically it's probably in three principal areas. We have helped plans think through and think differently about the way they need to look about containing costs and helping provide, again, quality care and better outcomes. And so, we talk a little bit, Sally, you and I have talked about this, I think, briefly in the past about our culture. Our culture is very, very important to us. It's something that probably has been the biggest distinction in driving us forward. I joke about yes and, but yes and is one of four pieces of our business, right? It's simplify the complex. Healthcare's messy. We're trying to make it easier. Get comfortable being uncomfortable. the whole idea is you're going to do new stuff. Let your people do what they do best, is make decisions. So empower your team. When you do that, they get a lot of stuff right and solve problems. They also sometimes get things wrong. We call that spill milk in our environment. We celebrate spilling milk. We celebrate the idea of learning. And then the last piece of it is yes and. And it comes from the improvisational world of comedy, where you don't say the words no, but, or however. You expand and explore and ideate and create and innovate and all of the types of things that bring you forward with change. And so we use yes and now our customers actually use yes and. In fact, in this room, you're going to find that there are about a half a dozen or a dozen customers that are on councils and committees with us as part of our business. We do a lot of outreach. They use yes and. They use spilled milk to drive their organizations forward. So it's been pretty fun. In terms of additional impact, we have taken on some new customers and, from an economic perspective, improved their position financially 20 to 40% overall cost of year-over-year cost improvement. Success stories with individual cases, whether it's a high-risk pregnancy or helping somebody with a very, very difficult situation in mental behavioral health. I can think of right now, coming out of the great disruption, there's been a lot of isolation and a lot of things tied to behavioral mental health, substance abuse. And we've had some really good outcomes there too. So.
That's incredible. And I don't know of a broker or an employer out there that wouldn't love the term yes and instead of no or but.
Yeah, it's tough.
So you mentioned earlier that you've embraced a number of new avenues. Can we list some of them?
Sure. When we first started on this journey in 2019, we had an ecosystem mentality. We had multiple products. They were just beginning to form and grow and become integrated, whether that was networks with utilization review and some case management, etc. In the last 2.5 years, we've built a concierge medical management program. So we have a navigation, direction of care, cost containment solution that starts right out of the beginning called NavCare. We're launching 2 new solutions here. One is called our care value optimization solution, which we'll talk a little bit about throughout the course of the next 2 days with folks. Really, it's a way of taking advantage of benefits in the 501R and COE bundled space that really aren't being adopted today. We acquired a stop-loss MGU, which is pretty exciting, because if you think about what's happened to stop-loss has historically become a commoditized solution. We've lost touch with the plan design. And so what we saw was an opportunity to be involved in plan design, be involved in all the aspects of controlling the cost and serving the member and creating a better experience for the member. And when you do that, getting some sort of underwriting benefit on the front end from doing the right things in stop-loss. And so we acquired Certus, phenomenal organization based out of Indianapolis, Indiana. And we're launching at the show V-Radar, which is our solution. And we'll work with other stop-loss carriers too, by the way. It's not exclusive to Certus, but we are launching it with Certus today, obviously, as an affinity company under the Valenz brand.
Awesome. Well, thank you for letting us be a part of that unveiling. So what does the future look like? I know you don't have a crystal ball. You didn't 3 years ago.
Nope.
When the world turned upside down, but that didn't stop you. So what's the future look like for you guys?
I continue to believe that there's more opportunity to enhance medical management, integrating data. We didn't even talk today about data, but data's fuel. I talk about it all the time. If you watch me on LinkedIn or other social media platforms, I talk about data being the fuel of change. It's everything that's out there is going to be centric around using data and creating actionable analytics around what you do. So there's going to be a need for us to get more involved in pharmacy. There's going to be a need for us to marry the data with pharmacy and medical. There's going to be a need for us to help folks think through differently about how you tackle certain of these problems when medical drives pharma, pharma drives medical. Oh, by the way, dental is involved in there too. So we're looking at that as an option as well. I think how the self-insured community funds risk is going to be an interesting direction for the space. I think we're starting to see that now. A little bit more innovation in the captive space, and you see some of the things Pareto's doing is phenomenal. I love those guys. And so I think the future's bright for this space. I think what we're doing for smaller and smaller employers to give them an opportunity to self-insure their risk and find ways to control the largest part of their program, medical. Right? Everybody gets caught up in this, my fees. Your fees are going to be 10% of your program cost. Your medical is going to be 80 to 90%, and 65% of that's going to be true medical, the other's going to be pharmacy. That's where you need to try and put controls around it to get somebody that's going to help you manage that well. So I think we're starting to see more and more adoption. So I think the future's bright. And I know from here to 25, we've got a lot to do.
And I have no doubt you and your team are going to do it. So
thank you
for being a part of today's podcast for the Granite List Live. Thank you for your continued support of SIIA and your leadership. If people will end with this, if people want to learn more about Valenz, where do they go?
You can go to www.valenzhealth.com. You can call any one of our executives. We're all on LinkedIn. We all have our numbers available, and we would be honored to have the opportunity to talk to you about solving needs.
Fantastic. Well, thank you also for your continued friendship with the Granite List, and thank you for helping us kick off this series of the Granite List Live, brought to you in partnership with SIIA.